off. Just find an excuse to win. Keep going. It pays.
Hi, I'm Lieutenant Commander Jim Cowan at BUD/S Physical Therapy. I want to talk to you on this segment about probably one of the most, if not the most common complaint that we have here at BUD/S, and that's knee pain. Approximately 30% of our class reports pain in the knee, and I think it comes from some things that you can work on before you come to BUD/S and fix fairly easily so that you don't have the common problem that we see here. So most of the problems that we see in terms of pain from the knee comes from three common locations. So this is looking at your knee as a model from the front side. This is your right knee looking from the front. Okay, so you have your thigh bone, your femur bone, your kneecap, and then your lower leg bones here. So if you rotate looking at your right knee from the side here, right, most of our common pain comes from three areas. Underneath the kneecap, where it rubs excessively hard on the knee. Underneath the lower tendon that attaches your kneecap onto your shin bone. Okay? And on the side of the knee as well. So these are the common areas where the pain comes from. Most of that problem comes from tight quadricep muscles. These muscles load the kneecap and really cause excessive friction on the backside of the kneecap. This is probably the most common sports medicine injury in the world. It's called runner's knee or patellar femoral pain. You may have been diagnosed with it in the past. And that rubbing, abnormal rubbing, really causes a lot of pain here at BUD/S. And soft sand running makes it even worse. So the most common thing that we're going to talk about is how to stretch out your quadricep muscle to unload that kneecap, how to stretch your hamstrings, which also let your knee open up a little bit more and take the load off that kneecap, and also how to stretch the tissue along the side of your knee, which is your IT band. And these three common flexibility areas make a tremendous improvement on how well your kneecap can track. Because if you're tight in all those muscles, it loads the kneecap up and causes really, really painful areas to occur beneath your kneecap. So the first stretch I'm going to show you is how to stretch your hamstrings properly. Right, the key to a good hamstring stretch really starts with standing up nice and tall. Okay, you actually even want to curve your back in a little bit because that starts the stretch on that hamstring. And then what you can do with your head up and your chest up, just make sure that you lean forward at your waist until you feel a nice hamstring stretch this way. And we recommend that you always hold a stretch at least 30 seconds in this position. Right? And here he shows it really well. What will happen though, and you can lose the stretch, is if you let your pelvis slump or you try to touch your toes and your back rounds out, that slumping takes the stretch off and you really lose that good stretch. So if you make sure that you really keep a nice straight back and you lean forward at your hips. Right, we're showing more of a traditional, just static stretch in this manner, although some people, me included, really do like more movement-based stretching. So another way that you could stretch your hamstrings in more of a movement-based pattern is to really keep your leg nice and straight. And this also is a very good balance drill as well. And then just bending forward to touch the floor, touch a ball, touch a weight bench, slowly back and forth like this is also a very nice way to stretch those hamstrings through more movement base, and people feel that this really is a better way to stretch, and I believe that as well. Okay, the next stretch that I like is a proper quadricep stretch. This really is important for your kneecap because it unloads how much pressure occurs on that kneecap. So the proper way to really do a good quadricep stretch, that quadricep muscle goes across your hip and your knee. So it's really important that you square up on whatever you're going to use to stretch, in this case a high bench. If you were in the weight room, you could use a rack or a pole outside, bench outside. The key is that you really push this hip forward to start the stretch. All right? And then with that forward hip position, then you can bend the opposite knee and really drop down into a good quadricep stretch. And as always, you would hold this for about 30 seconds. You can come out of that. Where most guys don't do this stretch properly is that, one, they hike their hip out. And then oftentimes they lean forward at their waist, and, right, and you immediately lose the stretch that way. All right? And they may even rotate a little bit if they're doing like a single leg stretch. So make sure that, I prefer that you put your foot up on something behind you, you really square up, get your legs together, push that hip out, and then really drop that other knee to get into a good stretch that way. Another stretch that is a movement-based stretch, like we show you with the hamstring, doesn't really focus entirely on the quad, but yet it's a very good hip stretch to keep your hip loose, which is involving the quadriceps muscle, and it is more of a dynamic rotational stretch. just a kneeling lunge with a nice rotation back and forth. Good. And you really want to accentuate a lot of trunk rotation and feel it through that front side of hip. So the last stretch that I recommend for the knee is for the IT band. The iliotibial band is extremely commonly inflamed here. ITB stands for I tried Buds. Everyone here at Buds has it. It's extremely painful. It's not dangerous, but it does give guys a lot of problems. That IT band starts in two places muscle-wise. One is off this front muscle under your front pocket, and the other part is off your butt cheek here in the rear area. And those muscles come together down the side of your leg and attach along the side of your knee right here. And at about 30 degrees of knee bend, it rubs. And once again, soft sand makes it extremely painful here. So this stretch is very easy to do. You simply cross your legs and you lean away, put your hand on that opposite hip, and you really just push into this front pocket. You may have to lean your trunk till you find it just right, but you should be able to push into this and feel your stretch really right under your front pocket. Right? The second half of that stretch involves the glute, which is then going into a figure 4 sit, and you cross your legs, and you can drop into a sit this way. And if you want to hold on to a weight, a bench or anything like that, a bicycle, that's very good. And you really should feel that in the rear glute portion there.